Colston here, co-owner of the Medicare Workshop alongside co-owner Kyle Welch, and welcome to the Turning 65 webinar. Today we're going to teach you everything you need to know about Medicare, what your options are, and what you need to do before you turn 65. Now I know this stuff can be very confusing. You guys are probably getting bombarded in all kind of different directions, but we're going to break this down for you as simple as we can so that by the end of this video you feel very confident about what Medicare is and what your two options are. We're located right here in Jeffersonville, Indiana. We've helped thousands of seniors across the states of Indiana and Kentucky, and we're going to go ahead and get right into this webinar. So let's go ahead. So this is what we call the Turning 65 Medicare webinar for you guys. Each one of you all watching this is going to fit into one of these 5 categories right here, so identify which category you belong to. The first one is that you've got marketplace insurance or that you're uninsured. Second is that you have employer coverage and that you're going to continue to work past 65 and you need to figure out whether you need to stay on that employer coverage or if you're better off going on to Medicare. Third one is retiree coverage. If you're one of the rare few individuals that still get retiree coverage, we need to compare that to Medicare and figure out which spot is going to be better for you. Number 4 is if you have veterans coverage. And number 5 is if you have Medicaid that will continue past 65. All right, so this is what a red, white, and blue Medicare card looks like, except it's going to have your name with your specific member ID number and then a Part A and Part B effective date that line up with your 65th birthday. So this is what a Medicare card looks like, just in case you did not know. Original Medicare is going to consist of 2 parts, as you can see right here, Part A and Part B. Part A is going to be hospital coverage. That is going to be a monthly premium of $0 so long as you have worked 40 quarters or 10 years and paid into FICA taxes. Part A covers inpatient hospital stays, hospice, home health care, and skilled nursing. Everything else is going to fall underneath Part B. Part B's monthly premium is going to be $164.90 a month. So Part A doesn't cost you anything. Part B costs you $164.90. This is going to cover everything else like I just said: doctor's visits, facility charges, outpatient services, durable medical equipment, ambulance rides. Everything else falls underneath Part B. Now, if you are currently receiving Social Security benefits already, you will automatically be enrolled into Original Medicare. You will receive your Medicare ID card 3 months prior to you turning 65, and that $164.90 is going to come right out of your Social Security check prior to you getting it every single month in your bank account. So you get to skip all the initial steps. That Medicare card is going to come automatically in the mail, and that money is going to come right out of your Social Security check if you're already drawing Social Security. If you are not drawing Social Security, you must manually enroll into Original Medicare, and there's 3 ways to do that. Number 1 is to apply online. It's the easiest way to do it. So it takes about 10 minutes to create a mysocialsecurity.gov account, and then it takes about 10 minutes to apply for Medicare. You can also do it over the phone by calling that number right there. However, that is the most lengthy way to do this. You're going to sit on the line for about 30 minutes, and then they're going to schedule you out for a later date to apply for Medicare. Then number 3 is to go into your local Social Security's office and apply that way. So if you don't know how to go online and do it, go ahead and go to step number 3, which is in person. Find your local Social Security's office and do it that way. If you absolutely have to, call in over the phone, but it's the longest, most time-constraining way to do it. Now, when does Original Medicare start for you? Your coverage begins the first day of your 65th birth month. So if you're born on July 24th, your Medicare is going to start July 1st. Now, the only exception to that is if you're born on the first day of a month, you're actually going to start 1 month prior. So if you're born on July 1st, your Medicare is actually going to start on June 1st. Now, these are your major points of exposure if you just have Original Medicare only. So if you get that red, white, and blue card in the mail and you do nothing else and it goes into effect and you don't have secondary insurance, you're going to have big deductibles and you're going to have 80-20 coinsurance. Medicare is going to pick up 80%. You're responsible for the other 20%, and this is uncapped, which means you're going to pay 20% on every bill no matter what. And there is also no prescription drug coverage.
So the best time to enroll into any type of secondary coverage We like to call it the 7-month window rule. This is just the best time to make that decision. It can be 3 months prior to your 65th birth month, the month of, and up to 3 months after, although we don't typically recommend enrolling after. Typically you want to get things done ahead of time. But that's the standard rule. Just 3 months prior to your 65th birth month is going to be the best time when you get that Medicare card to start looking at plans, or at least, to start enrolling into plans. Now we're going to kind of dive into the two different types of secondary coverage. There's Medigap or Medicare supplement plans. Those are the same type of product. Medigap and Medicare supplements, or there is Medicare Advantage, and sometimes you'll also hear that called Part C. Okay, so between the two options, there are pros and cons to both. When we talk about Medigap or Medicare supplements, you retain your original Medicare card and it supplements, it pays behind original Medicare. It's very good coverage. It's very good first dollar coverage. It's not networked. You can go see any doctor in the country that accepts original Medicare, and there are never any referrals or prior authorizations to have any services done. Now, on the negatives to that type of coverage is the price. They're significantly higher in cost than the other option, which is Medicare Advantage. Also, the price of those increases as you get older. So where you start when you're 65 is not where you're going to be at. You're going to be paying a higher price by the time you're 70. They also do not cover prescription drugs, so you have to add prescription drug plans, which is an additional cost. And there is no dental, vision, or hearing coverage associated with those. So if you want that type of coverage, you're going to have to pay an additional premium for that as well. Now, when we talk about Medicare Advantage plans, why people like those? 0 premiums most of the time. So you're still going to pay for your Medicare Part B, but you're not going to have an additional premium typically associated with a Medicare Advantage plan. They come with all the extras, the dental, vision, hearing, the over-the-counter food cards, the over-the-counter cards, the food cards, the gym memberships, etc. And prescription drug coverage is almost always included with those. There are some exceptions to that. Typically, that would be by choice, though. So if you're going to choose Medicare Advantage, prescription drug coverage is probably going to be built in as long as that's what you need. Now, on the negative side, there are copays. You potentially have higher out-of-pocket costs on Medicare Advantage than on Medicare Supplement, although that's not a guarantee one way or the other. People save money on both sides just depending on their circumstances. They are networked, which can sometimes be a negative. Oftentimes it's really not. The networks have gotten very, very good. These plans have become very popular, so the networks are pretty good on these plans at this point in time. And then there can be referrals or prior authorizations. That probably works more similarly to how your coverage is today if you're employed, or to how your coverage has been in the past. It's how my coverage works. If I go get an MRI or a CT scan, the facility is going to go ahead and reach out to the insurance company a week or two prior to that and make sure that everything's good to go and that they're going to pay for that service. Here is a chart outlining Medicare supplement plans. In most areas, the two popular plans that we're really looking at is typically just Plan G and Plan N. Now, these are standardized plans, so it doesn't matter the company that's offering those. A Plan G is a Plan G, and on a Plan G, as you can see, like we said earlier, very good coverage. Everything is supplemented on Medicare Parts A and B except for that Medicare Part B deductible. In 2023, that's $226. So essentially on a Medicare Plan G, you're going to pay the first $226 for all Part B services. You're going to have 100% coverage after that. That does exclude medications. That's something totally separate on this side. On a Plan N, very similar. It's going to be lower in cost per month than a Plan G. You're still going to have that Part B deductible. And then once your deductible is met, you can pay up to $20 at an office visit and up to $50 for an emergency room visit. A Plan N also does not cover something called a Medicare Part B excess charge. These are very rare. Over 97% of doctors are going to just accept Medicare's assigned rate, but in the case that they wouldn't for a certain procedure or service, you could be billed up to 15% above and beyond what Medicare charges for that service on a Plan N. So very rare, but it is a point of exposure on that plan. There are tons of companies that offer Medigap or Medicare supplement plans. These are just some of them. I mean, you're going to get mail from all kinds of different companies. You've got the big companies. Typically, we want to work with more reputable companies that are high, A-rated or higher. But you're going to get mail from all kinds of different companies depending on where you live. All kinds of different companies offer them, but there is no difference in what they're offering. So Medigaps or Medicare supplements, like I mentioned previously, are standardized plans. And we put the picture here of the gas pump, and we always talk about, if gas is $3 on one side of the road and it's $3.30 on the other side of the road, well, you're going to go to the one that's cheaper. That's exactly what we're talking about with Medicare supplement policies. They're standardized. A Plan G is a Plan G. It doesn't matter whether Humana's offering it, United Healthcare, Anthem. The only difference is the price that you're going to pay when you start off on Medicare or when you first take it. Also, there can be slight differences in how they increase over time or what their rate, how aggressively they increase in price over time. And then the customer service is going to differ from one company to another. Typically, your bigger A-rated companies are going to have higher levels of customer service. So if you choose this option, if this is the option that you decide to go with, you're going to have, we have 3 cards here. You're going to have at least 3 cards. You're going to have that original Medicare card. It pays first whenever you go to the doctor's office or hospital. Then you'll have your Medicare supplement card. It pays behind. And then also typically you're always going to have a prescription drug card for that Part D plan. Now, if you decide to add dental, vision, or hearing, which most people do, you're going to have an additional card for that as well.
All right, it's me again. So we're going to go over Medicare Advantage plans. So this is your other option. First option that Kyle just went over was Medicare supplements. Now this is the second option, so you guys don't get confused. So if you go with the Medicare Advantage plan, this is considered privatized Medicare. It's Parts A and Parts B services now paid for by a private insurance company opposed to Medicare paying for it. These companies can typically give you extra benefits like dental, vision, hearing, food cards, over-the-counter cards, gym memberships. They're allowed to customize these plans a little bit differently on this side, and typically they include prescription drug coverage. Now, when you're looking at it, this is what happens when you're looking at original Medicare versus a Medicare Advantage plan. So with original Medicare, you have that 80-20 coinsurance, and there's no cap limit on it. If you go with the Medicare Advantage plan, you're going to pay significantly less than that 20% you would have been responsible for, and there is called it's a max out of pocket. It's your safety net. So you do have a cap limit when you go to a Medicare Advantage plan, and that's a huge deal. You also, with original Medicare, the left side here, you're not getting any dental, vision, hearing, you're not getting any food card, over-the-counter allowances, no gym memberships, and no prescription drug coverage. So if you go with a Medicare Advantage plan, remember it's a $0 plan, it's got co-pays, and then it's got that safety net max out of pocket, and then you get all the extra benefits like the dental, vision, hearing, food card, gym memberships. So what companies are offering Medicare Advantage plans? You've got several different companies in the states of Indiana and Kentucky offering Medicare Advantage plans, such as Humana, United Healthcare, WellCare, Cigna. Now, there's a lot less companies offering Medicare Advantage plans than Medicare supplements, but each one of these companies listed here have multiple different plans. Some counties in the states of Indiana and Kentucky have up to almost 40 different plans to choose between. So it's very important that we look at all 40 different plans and narrow down which ones make the most sense for you. So which company do you go with? It's very important when you're looking at a Medicare Advantage plan. The first 2 things that we look at is medications. We got to make sure that your medications are being covered at the lowest possible cost. The second thing is, remember that these are networked plans. So we have to make sure that your doctor takes the plan. And then every company has their strengths and weaknesses on dental, vision, and hearing. So it's important that as long as we get the first 2 right and we find a company that's covering medications right and all your doctors are covered, the very next thing we look at is, what do you need? More dental, more vision, more hearing, and then we get a plan set up for you that's going to work best for you based on what you need. And then these companies also have different methods of over-the-counter allowances and food cards. We want to make sure that if we can, we hook you up with a company that is going to give you an over-the-counter and food allowance that you can actually use, and it's not a headache for you. Now, when it comes to Part D prescription drug coverage, now we're going to go back to talking about both sides here. So when it comes to a Medicare supplement, you're going to have a separate but additional premium for that drug plan. And you're also going to be subject to a $505 deductible. Some tiers are excluded, but some tiers you're going to have to pay the first $505 before the insurance kicks in. Now, if you go with a Medicare Advantage plan, that drug coverage is going to be included at no cost because the plan is zero. And then most drug plans that are included will have a $0 deductible. Most. Not every single one, but most. You will not have to satisfy a deductible before the insurance kicks in. Now, which drug plan is right for you? There is no guesswork when it comes to figuring out which drug coverage is right for you. You're going to give us a list of your medications. We're going to punch them into a software, and it's going to spit out down to the penny which company is going to cover you best. It's going to tell us for the entire year, down to the penny, what you're going to pay for your medications, and it's going to list them in order. So we know that if we get past the first page, we're getting more and more and more expensive on your medicines. We don't want to do that. We want to look at the top 3 or 4 options and figure out which one is going to be best for you. But there's absolutely no guesswork. We can tell you down to the penny what you're going to pay. Do you even need prescription drug coverage? The answer is yes. Even if you're not taking any medications, you need to get prescription drug coverage because the rule states that if you go without drug coverage for more than 63 days, then you're going to start to incur a lifetime penalty. I don't agree with the rule, but I'm here to let you guys know you have to get drug coverage. It's one of the most common problems we run into with people that are over 65 that never got a drug plan, and now they have a lifetime penalty. So make sure that you get drug coverage. Now, when it comes to employer coverage, if you are still currently employed and you're debating on whether you should stay on your employer coverage or go to Medicare, you can do one of two things. You can either enroll into Medicare with an effective date being your 65th birth month, or you can delay your Part B until you decide to retire. Now, there's 4 important factors that we look at when it comes to deciding what's best for you. Number 1 is we're going to compare your medical benefits on your employer coverage, which is what is your deductible, your copays, your max out of pocket. What does that look like on your employer coverage versus Medicare? Number 2 is we've got to compare your monthly premium cost. What are you paying for that employer coverage versus what would you pay if you went on Medicare? Number 3 is, do you take any high-cost medications? Are they being covered better on your employer coverage, or are they going to be covered better on Medicare? And then number 4 is, if you have a spouse that is dependent on your employer coverage and they are not of Medicare age yet, if you go on to Medicare, essentially they're going to lose your employer coverage. So we have to find a way to cover them if that's the case and you come off of that employer coverage. VA and TRICARE coverage. If you're a veteran, if you've got just VA benefits, you do have the option to opt out of Part B. However, Veterans Affairs recommends you get Part B. Otherwise, you are going to be married to VA facilities for the rest of your life. You're going to have to go by what the VA wants you to do. You no longer have access to private doctors and second opinions outside of the VA. So it's recommended, even if you have veterans coverage through the VA at a VA hospital or VA facility near you, get Part B so that you have the option to go outside of the VA if you need to. Now, if you have TRICARE for life, you are going to be required to take Parts A and Parts B. But don't worry, there are plans out there that are going to give you a Part B reduction for being a veteran. Medicaid eligibility in Indiana and Kentucky is a little bit different, but to generalize for you, you have to have limited income and resources. They're not going to count your home as an asset. And if you get Medicaid and you're qualified for Medicaid, you're not going to have to pay the Part B premium. Your medical cost is 0, and your prescription cost will also be 0 as well.
Okay, so Kyle back here, kind of finish you guys out. We want to make sure that you think long and hard about the differences between Medicare supplements and Medicare Advantage. We're happy to answer any questions for you in your one-on-ones afterwards, but think long and hard about whether you feel most comfortable on the Medicare supplement side or on the Medicare Advantage side. It's a decision that if you're not going to remain on employer coverage, or you don't have an option for retiree coverage that you're going to have to make. So think long and hard about that. But we're going to round you out with some myths. One of the most common myths is that you must have to pay a fee to use a broker like Garrett and myself, and for our services and our help with all this. The truth is, there are absolutely no fees associated with our services. They're 100% free to you. As a matter of fact, we're going to help you find a plan that meets your needs best. And we charge nothing. The insurance companies don't charge you an extra fee. The price you pay from the insurance company is exactly the same whether you use us or not. So we definitely encourage you to use a broker. It's to your benefit. Myth number 2 is, well, nobody works for free, so I kind of just covered this. Insurance companies must be charging a higher price if you're going to use us as a broker. Like I just said, you're going to pay the exact same price whether you use us or not. The insurance companies do pay us. That's a service fee because we service our clients for life. So you don't pay a fee, they don't charge you any more for using somebody like us. Definitely recommend doing so. If we get paid by the insurance companies and we must have bias towards one company or the next, it's not really true either. Our goal is to make sure that you are happy as our customer. So the insurance companies all pay us pretty similarly. They don't pay us the exact same amount, but it's not enough to push you to one company over the next. Like I said, our goal is to make sure that you're happy, that you're in a good fit, because in insurance, in our business, we really don't make a lot of money off of the first year. We have to have a lot of clients for the long term. So we want to put you in a spot that meets your needs best. If we need to move down the road, we'll help you do that. But we're trying to look for the best spot for you so that you stay with us. So there's a 3-step process to all this. Step 1, you all have already knocked out. You've came to our educational webinar here. You've watched it. Hopefully you've learned a little bit and you've got the wheels turning as far as what you need to do next. But we're going to help you with all that. So your second step is going to be to go ahead and schedule your free consultation. We'll have a gold telephone up here. Can't encourage you enough. Go ahead and get that scheduled. Very simple. You're not going to get a hard sell. We're educational. We're going to walk you through this, hold your hand, make sure that you get put in the right spot. We're going to dive into your specific situation because everybody's different. I can't tell you the biggest mistake that we see when it comes to Medicare and these plans is that people making decisions based on what their brother or their neighbor or their sister or whoever else did. This should be tailored to you and what you need. You know, your financial needs, your health needs, your needs for medications, your doctors, etc. So book your appointment. We're going to start diving into your situation, where you're at now, your roadmap as far as when you can expect that Medicare card if you haven't already gotten it, and set forward a timeline into getting you enrolled and making sure you get your cards and everything well in advance of your 65th birth month. And 3, if you do that, you're going to get lifetime billing and claim services from us. So we take pride in making sure that we stay in contact with our clients, making sure that they get their cards on time, making sure that all their questions are answered, wishing them happy birthday and reaching out during the holidays several times a year, making sure that they know that we're a resource to them and we're here to help them, whether it's with a question or a concern, a complaint, whatever it may be, we're here to help. So this has become an industry with all these commercials that's relied less and less on service. We don't take that approach. We don't believe that's the right way to do this. You do business with us, it doesn't cost any money, and you're going to get service for life. We think that's very important. So that first step call, if you go ahead and book that, could be as little as just we say 10 minutes. A lot of times it doesn't even take that long. A lot of times it's 5 minutes just to set forth that roadmap, get you a timeline. You don't need to make any decisions. Nothing's going to be urgent on that. It's just your initial timing, and to make things very clear for you, answer any questions you may have had after watching this webinar today, and then get the ball rolling for you.
All right, and that's the end of it. We tried to make that as short and simple and sweet as we can. We want to thank you guys so much for joining our webinar today. There's a reason why we're the #1 agency in Indiana and Kentucky. We treat every client like their family. And if you don't believe us, go ahead and check us out on Google. You'll see all the 5-star reviews that we've been able to accumulate over time. Really look at that, because we want you guys to vet us and make sure that you're happy with the decision you made, and I think those 5-star reviews will do it for you. So that's it from me and Kyle from the Medicare Workshop. We've helped thousands in the state of Indiana and Kentucky, and we'd love to help you too.